Hello, I am Petronille Bogeart. I work at the European Commission in DG Santé in the unit C3, which is State of Health. And I will be talking just a couple of minutes on the health workforce challenges that we see across the EU. So first of all, we have an aging population, which we need increasing care because the population is not only getting older in good health, but also with disabilities and comorbidities. This also means that our health workforce is actually getting older, and this leads to more doctors and nurses coming closer to the retirement age. Another challenge we see is the difficult working conditions. We know that also, of course, during the pandemic, but afterwards, the surveys have shown us that nurses and doctors have evaluated their jobs as being a high job strain and having a hard work intensity, and also burnout levels are relatively high in the health sector compared to other sectors. Furthermore, we also see a decreasing interest, unfortunately, in health professional careers and a shifting composition of the workforce. What do I mean with that? Is that more health professionals are specialized rather than having a more general family medicine or a general practitioner career. And then lastly, there's also an uneven distribution of the health workforce. So some regions that are more rural have less access to healthcare facilities, but also less access to the healthcare workforce, which may, in some regions, be less attractive to health professionals. So what opportunities does that lead us to? We have to think about improving health workforce planning and forecasting. We have several projects at EU level, such as a Joint Action Heroes, which is looking at strengthening planning and forecasting in member states and across the EU. We also have to think about increasing education and training, not only students, but also lifelong courses and learning across the professional life course. And then improving working conditions and well-being, of course, is also very important to not only attract new staff, but also to keep the staff that we have, so both recruitment and retainment. And finally, the other opportunity is innovation. So we need to optimize the use of skills and new technologies as these are rapidly evolving, and our health workforce may have opportunities in making use of them in the future.